Hello and welcome to Continence Chat. My name is Susie Fox. My colleague and co-host Deanna Vigliotta and I are thrilled to have you join us today. And we'd like to introduce you to our guest. Bob Batchelor is the Managing Director of Flying Angels, and he holds degrees in Doctor of Nursing Practice, Certified Flight Registration Nurse, Critical Care Registered Nurse, and Certified Dementia Practitioner. Bob, welcome. We're thrilled to have you with us, and we'd love for you to tell us about Flying Angels and how you got started in providing this service.
Sure, Susie, Deanna, it's actually a pleasure to be here. Thank you for having me. I've been following the podcast for a while, and I kind of feel like it's nice to, follow in the footsteps of some of the terrific guests you've had over the course of the last year or so.
Oh, well, thank you.
Thank you. We're thrilled to have you here. And, Susie and I started this podcast, well over a year ago, initially talking about continence care, but it really has evolved into more of a resource for anybody who's involved in the aging space and caregiving. So we're honored, as Susie mentioned, to have you here.
That's a pleasure. One of the themes that I have picked up on your podcast are, people discovering resources that people did not know existed. And to be completely transparent, if I had a nickel for every time that somebody said, we didn't know Flying Angels was a resource, I'd be rich. I think my downside, I think, would be I'd be spending all my time wrapping nickels. So, that said, I'll jump in. So I'm a nurse. I collected a bunch of letters after my name. I've been a nurse for just over 30 years now. And in a previous interview once, somebody said, well, Bob, you're just the typical dude nurse. And that's actually true. When I went to nursing school at Community College of Philadelphia, and this would have been, again, just over 30 years ago, I didn't think I was going to be a nurse as a career. It was one of those, I figured I was going to have a family, have kids, and, I wanted to make sure I had something that, that I, could do in the event that I needed to support my family. And I got out of nursing school and I got into an ICU trauma unit here in Philadelphia, which is where I'm from. And I kind of fell in love with it. From that point forward, I was doing all of the things that dude nurses do. I worked in trauma. I worked in burn. I worked in the ICU. I would kid my friends that I liked a nice, quiet Friday night in the trauma bay. That's where I wanted to be. People would ask me, they would say, Bob, working Friday night in the trauma bay. And they said, Bob, you're so calm. How do you stay so calm? And I say, well, I have a wife at home with 3 kids under 5 years old. I've got the easy job. Let me tell you about that. So, no, that was fine. But, as most dude nurses, do, we want to be flight nurses. We want that adrenaline rush. We want to be up in the sky and having, providing care there. Problem was that I live in Philadelphia. And it's a major metropolitan area. We have multiple terrific level 1 trauma centers all over the city, and they're all in close proximity. So there's we have a few helicopter programs, but for every helicopter nurse position, there's probably 10,000 terrifically qualified interviewees. So that didn't work out. But about 20 years ago, a friend of mine asked me to help fly his grandfather from Florida up to Toronto, Canada. And I said, sure, it sounds like a great thing to do. I'm a nurse, it'd be fun. And this particular person had dementia. And as a lot of dementia practitioners will tell you, people with dementia often respond better to professional caregivers than they do with family, which is one of the reasons that they wanted me to do this. And I said, sure, I'll go down. So, I wound up getting him to the airport. I wound up getting him on a flight. I was sitting in first class because we agreed that's what we were going to do with the patient. And I said, well, this is great. Sitting in first class is wonderful. I've never done that before. And we're flying along. I'm reading Sky Mall. Again, going to date myself there with Sky Mall. He's sitting next to me. And about halfway through the flight, he stands up, says, help, help, I'm being kidnapped. Now, you have to keep in mind, this was not that long after 9/11. Nobody had a sense of humor on airplanes at this time. So I did what any dude nurse would do. I injected him right through his pant leg with some sedative that I had ready to go. He sat down, went to sleep. I told the flight attendant, oh, he just had a bad dream. Everything's fine. And I said, you know what? This is it. This is my career. This is what I'm going to do for the rest of my nursing career. That was 20 years ago. Here we are, Flying Angels has doctors and nurses all across the country who accompany people who have medical needs on the commercial airlines. So what we're doing is we're providing a nurse or a doctor, 99% of the time it's a nurse, to fly with somebody who has medical or cognitive needs. We do a lot of dementia transports. A lot of the folks we have mobility impairments. And we can talk about the continence aspect of that later on too, because that actually is a big issue of our care. But we transport these people with a nurse on a regularly scheduled commercial flight, Delta, American, United, around the country. We transport foreign nationals to their foreign countries. As I was mentioning, we transport patients to China and India. And we're also bringing American citizens back who may get injured overseas here to the US. And again, we're doing it all on the commercial airlines. We are transporting those people who need medical care, need to get long distances, but don't necessarily need that ICU level of care that an air ambulance would provide, a private jet. And just like when you travel to a conference or when I travel to a conference, I'm flying on a commercial airline. I don't have private jet money, so it would be nice, maybe someday, I don't know, but at least not doing what I'm doing. So,
Wow.
so that's how we got started, and it was 20 years. So here we go from me just flying grandpa, to Canada, to now having staff all across the country flying with people on commercial airlines.
Wow. How mobile does the patient need to be, Bob, for you or your team to assist them?
Absolutely not mobile at all. We do a lot of spinal cord injury patients, traumatic brain injury patients, stroke patients. If you just think of a quadriplegic, high-level spinal cord injury patient who we routinely transport, they have zero mobility. The only limitation that we do have when we're flying somebody domestically is they do need to be able to physiologically tolerate sitting up in a first class seat. They need to be able to sit up for takeoff and landing. That's an FAA regulation. And when they're flying, they need to be able to sit in a reclined position throughout the flight. We have the specialty equipment to get them from where they are to the door of the aircraft. We have special slings and transfer devices to get them from the door of the aircraft into their first class seat. And then again, we have getting them off the plane is pretty much the same route. So in a typical transport, let's just say we have somebody who had a stroke, who really is not weight bearing, can't stand up at all. Our nurse will pick the patient up at the residence or the facility where they are. We have special reclining wheelchairs that we use to get them to the airport. So we'll transfer them right into a reclining wheelchair. We'll load them into a wheelchair van, take them to the airport, wheel them all the way through the airport up to the door of the aircraft, and again, use our special equipment to get them from the door of the aircraft into the first class seat. Again, we're flying first class with our patients, so usually it's only a matter of 10 or 15 feet from the door of the aircraft to their seat. And then again, when we get to the other end, we can repeat the process. We use special gel pads for our patients who are non-mobile, non-weight bearing, and are at risk of skin breakdown. We have special torso straps that secure them both in a wheelchair and in the seat if they don't have good trunk control. So, if they can physiologically tolerate sitting, we can transport them.
Wow. I'm curious, Bob, I live in Florida. My mom's up in Massachusetts, and I know in Florida we have a lot of snowbirds. Do you do a lot of transport for moms or dads that would be coming down or going up back and forth so they become customers for life, so to speak?
Yes, they do. The snowbird migratory season is what we call that. And, we are a terrific option for families who want mom and dad to have that independence to be able to, maybe it's mom, maybe it's dad, maybe it's both, They want to be able to get down to Florida. They want to be able to get back home to Massachusetts. The family said, well, maybe they can do it. Well, the other option is just call us and, we'll send a nurse or two if it's mom and dad. And, we'll take care of getting them from, let's say they're at a residence or an assisted living facility in Massachusetts. We'll pick them up there. We'll get them on a flight and we'll take them down to Florida and we'll get them to the facility or residence where they want to go. And then back, several months later, if they want to go back, we'll take them back there too.
Wow. Interesting. Go ahead, Susie. I'll jump in afterwards.
Okay. I'm curious, does insurance cover any of the services you provide?
Unfortunately not. This is usually a private pay situation. So, our service is not necessarily for the casual traveler, the one who says, well, it might be nice to have somebody to go along. This is for somebody who kind of needs the service. And, without us, the question would be, can they do it? Can they get there? Would they have to charter a private jet? So it's not inexpensive. I mean, we try to be very transparent with our pricing when clients call us and ask us, how much is the factors, that go into cost depend on what the airfare is, what the ground transportation is. Are they 5 minutes out of Boston, or are they, 20, are they 50 miles, in Connecticut somewhere. But as a general rule, we tell people it's going to cost $8,000 to $10,000 for one of our nurses to take a patient, anywhere within the continental United States. I mean, as a general ballpark rule, that's about what it costs.
Mm-hmm. And I'm assuming all ages would be your audience that need the service.
We don't do a whole lot of neonates, but we do pediatrics, we do kids. And, we did a 103-year-old, God bless her, yesterday. So anything, I guess 3 to 103 so far is where we are.
Wow. And how about, I'm going to call this an add-on service, maybe. Let's say I know it's Flying Angel, so I may be answering my own question, but you tell me.
Okay.
But I'm curious, if you had a family member who maybe was in another part of the country and there was a wedding, do you add on any services if need be? So if I wanted to fly my grandmother down, great grandmother down to a wedding, but I was tied up with the wedding activities of my son or daughter or so forth, and I wanted my mom or dad there or grandma there, but I didn't want to have to worry, or I'm not capable. I'm not an RN, not an LP, anything like that. Do you do anything like that, or are we strictly talking about the logistics of travel?
So we're strictly involved in logistics of travel, and it's a terrific question, and it's a question we do get asked routinely. And the reason that we're involved strictly in logistics of travel is because we're using nurses. All of our staff that on the nursing side, and the doctors too, are all critical care trained, registered flight nurse, physiology, air physiology trained. Nurses are licensed by state. And the problem we would run into if we offered that service would be, if I have a nurse, say, who's in Chicago, flies up to Boston to take the person down to Florida, well, they can't do nursing services or provide nursing care in Florida because then they'd be practicing it out of their state, which is not kosher. So, we can do this as our liability covers us as long as we're doing a point-to-point transfer. So, in these situations, we have transported people to weddings in the past, but we kind of have to be very clear and transparent. We'll fly them down, but we kind of have to hand care off once we get down there. And then at the end of the wedding, when they're ready to come back, we'll pick them up and then take them back to where they go. Yeah. But it's just not practical for us to provide that hands-on care, while they're there because of the nursing, the restrictions on nursing licensure.
Yeah, that makes sense. Now that you've explained it, thank you. That makes a whole lot of sense.
I noticed that you have 300 customers that have given you a 5-star review. That is phenomenal.
We are incredibly proud. We're just over 360 now. It's funny. I often tell people, I'm going to say great things about our team. I'm going to say great things about Flying Angels and what we do and how wonderful we are. But what other people have said about our service counts far more than anything I could say. And some of our clients have just been incredibly gracious in their praise for our staff. I routinely say when somebody's trying to pick which service they're going to use, or they're going to use Flying Angels, I say, Google us, Google Flying Angels Philadelphia, or Google Flying Angels reviews. I mean, try to do something neutral, and you'll find, the words people have said on Facebook, the words people have said on Yelp, the words people have said on Google, and these are all independent. These are people who have done this of their own volition. And have shared their experiences, and many of them have gone into just tremendous detail on what we've done. And we service the Indian diaspora, repatriating Indian nationals back, and that they can be a very cautious lot, justifiably so. And we've had many Indian patients leave reviews, and I say, well, just go through the list. I'm sure you're going to find a dozen or so be patients who had a similar experience to yours. My grandmother wanted to go home, or something of that nature. And invariably, they'll find a review that kind of matches what their story is. And that often puts people at ease for using our service, because people are trusting us. They're trusting Flying Angels. They're trusting our coordinators, are trusting our nurses to care for their loved one. I mean, that is not an inconsequential amount of trust that they are giving to us.
Yeah.
And we take that trust, very close and very dear to heart.
Yeah. Do you have a memorable, I'm just curious, with all of your experience behind you, a memorable story, a positive story where you really felt, oh, we made a big difference in this person's life?
Yes. And at the risk of getting a little emotional here, we do a lot of hospice transports. We do a lot of end of care, end of life transports for people who want to get home. And several years ago, I had a young woman who was here. She was actually from Georgia, Tbilisi, the old Soviet Union, Georgia. And a younger woman, and she developed cancer, and it was going to be terminal, and she was here alone. All of her family was in Georgia, Tbilisi, the city capital, and they wanted to get her home, and she was really pretty sick. I wound up flying her myself because she was so sick. I always tell my team I would never have anybody fly a patient that I wouldn't fly myself. And I picked her up, and we flew her from Los Angeles to Frankfurt, and then Frankfurt to Tbilisi. And we got into Tbilisi at I guess about 7 o'clock at night, and there were about 60 family members at the hospital. I mean, just extended family. And it was a heart-wrenching scene. Her mother, her sisters, she had a daughter there, and it was just heart-wrenching to see them, and they got to see her. And the family took me out. Now, I had been up for 32 hours, so they were trying to be very gracious and take me out to see the city. About in that 2 hours, I'm like, please, I just need to go back to my hotel and go to sleep. I was exhausted. And the next morning, I decided to just stop by the hospital, and so she had passed overnight. She passed at 11 o'clock that night, and the 4 hours after we landed. But sorry. She passed surrounded by family. She passed surrounded by those people that she loved. And that was, that's one of the most rewarding things that you can do. On a happier note, we had a gentleman, one of our nurses transported just 2 years ago. And it was a very, very routine transport. Older gentleman, very quiet, very reserved, very dour. Hadn't been out of a nursing home in 10 years. Nurse wound up taking him onto the aircraft. Well, when they got to the aircraft, it turned out that this guy was a bomber pilot in World War II, and getting him on an airplane, all of a sudden, he just came to life. And he started talking about, that flying. He loved flying and, hadn't been out of nursing home in 10 years. And here he is. He's talking to the crew. I mean, the crew wants to take him up and put him in the cockpit of the plane here. I mean, because the pilots, they're doing that pilot to pilot, chatting. And he just, I mean, this person came back to life, if you will. And just had, and it was just an incredible experience. It was an incredible uplifting experience, to just make that much of a difference. And apparently, when I got him in the nursing home, he was still much more chipper and cheerful, even after that. He was back in an airplane. That's what he loved doing, more than anything else in his life. So on a daily basis, we touch families, we touch lives. And, as a nurse, as a clinician, I think that's a joy. And that's one of the reasons that our staff love what they do. We get to make a difference. Too much of healthcare has been financially driven. I don't want to get beat up on healthcare too much nowadays, but too many people who are clinicians just feel like cogs in a machine when they're in a hospital, and they're unable to really make a difference. We get to make a difference every day. And I'm very blessed and I'm very fortunate. I'm very happy that this is something that we routinely do.
Yeah, that's phenomenal. Kudos. That's just incredible story. How much notice is needed? I'm sure, like anything else, the more the better. But
you took the words out of my mouth there. That was terrific. Yes, the more the merrier. I mean, on average, 5 days, 5 to 7 days is probably about what's good. We're flying on commercial airlines. We have nurses on standby all the time. I mentioned some of these repatriations from abroad, where we'll get called and they'll say, hey, how quickly can we go? And I'm like, well, it's 2:00 in the afternoon. I can have a nurse on a plane at 7:00 tonight to get this person home. But for normal transports within the US, it's what's available on the airlines. When somebody calls us the Tuesday before Thanksgiving and say, hey, I want to fly tomorrow, well, that might be a bit of a problem. And it also impacts the cost. That's one of the reasons we try to be transparent about our pricing, because that last minute ticket is tomorrow, plus I'm trying to get my nurse out within 24 hours, is probably going to cost more than hey, if we're doing this 3 or 4 days in advance. The snowbird migratory season, as we call it, is a typical example. Those flights kind of sell out, and so it's one of those. To answer your question, a week is good. 2 weeks is better. Beyond that, it doesn't really make a whole lot of difference. But we have people call us and say, hey, mom broke her hip. She's in a rehab. We want to get her home, but the receiving facility is only going to hold a bed for 72 hours. Well, in that case, we better move quickly. So that's one of those cases where, if we need to go in 48, 72 hours, we can do that, as long as there's seats available on the flights.
Interesting.
Well, it's good to know that you've got a team that's ready for the emergencies that take place, the unexpected. And I just want to thank you. I didn't know about Flying Angels, but what a gift.
Well, thank you for helping me share the word. Again, as I tell people, we go to a lot of conferences, and the number one response is, "Well, I didn't know that service was there." Well, it's not my lack of trying or trying to spread the word. So I sincerely appreciate your giving me the opportunity on your podcast to share the word about what we do. And this way, people will know that, hey, this is an option, if needed.
Yeah, it sounds terrific, and it's answering, I'm sure, a big need for lots of families, not just in America, but globally. So thank you for that, and kudos to you and your team for the great work that you're doing. We appreciate you.
Well, thank you very much, and thank you for sharing the word about the services, the terrific services that are out there, not just ours, but the advocacy services and the care management services, and all these resources that are available to those who need them.
Yeah, super. And Bob, how do people reach you? What's the easiest way for folks that may want to get additional information?
Well, the easiest way to go is just go to our website, which is www.flyingangels.com. We have links where you can call one of our flight coordinators. All of our flight coordinators are also from our nursing pool. So all of our flight coordinators are clinicians. So you can immediately call our main number. And the person who answers will be able to have a conversation with you about, is our service appropriate, and is this something that we can do? Or there's a fill-in, you can just fill in a little questionnaire, and we can get right back to you. But we have people monitoring. I don't want to say 24 hours a day, but most of the day and the evening, we'll have somebody getting back to you, pretty darn quickly.
Super. Well, thanks again. We appreciate you, and we hope that a lot of viewers take advantage of your services. It sounds like it's much needed and wonderful. Thank you.
Susie, Deanna, thank you very much for having me.
Thank you.